Hello and welcome back to GP Video Podcast by Nadia. So today the topic that we are going to start is called perinatal depression. What is perinatal depression? It is a mood disorder that occurs during pregnancy and after childbirth. So if it's during pregnancy, we call it antenatal depression, and if it's after childbirth, it is called postnatal depression. And overall, the term that we use is called perinatal depression. So the mood disorder symptoms can range from mild to severe, and in rare cases, the symptoms are severe enough that a mother and her baby's health and well-being may be at risk. So this is a very, very important topic to discuss and be aware of it. So if we look at therapeutic guidelines, this says that approximately 10% of pregnant individuals experience depression, which is a big percentage. In Australia, suicide is a leading cause of death during the perinatal period, exceeding causes of death directly related to childbirth or its complications, which is again a very, very important thing to know. So suicide is a leading cause of death during the perinatal period. Perinatal means both antenatal and postnatal, exceeding causes of death directly related to childbirth or its complications. Although reducing psychotropic effects on the fetus is important, it is equally important to not to undertreat depression during pregnancy because of increased risk of suicide and other adverse obstetric and neonatal outcomes. So see, this is a very, very important paragraph that I just read for you. It actually tells us that the suicide rate or the death because of the suicide because of perinatal depression is actually, the death rate is higher as compared to the death rate that a mother would experience because of childbirth and its complications. So this is, I'm sure in third world countries, it's the childbirth related complications which could cause death, both maternal death and fetal death. But in Australia, the perinatal depression and related suicide is actually the bigger cause of death than childbirth and its complications. So which is a very, very important thing, and it's a very, very important condition to consider in Australia. During pregnancy, people with depression are more likely to report physical pain, gastrointestinal symptoms, and dizziness, and often have comorbid anxiety. Again, another point that I read in the above paragraph, which said that it is very important not to undertreat depression in pregnant ladies. So see how we take sometimes, not sometimes, but most of the times depression is taken for granted, and taking an antidepressant is considered a stigma, and that can actually endanger both the lives of the mother and the fetus. What happens is, I've said this a lot of times in my video podcasts, that physical and mental symptoms are always correlated. So mental depression and anxiety can cause physical symptoms both for the mother and the fetus, and can have adverse effects for both of them. Similarly, people with depression are more likely to report pain. So pain is a physical symptom, but mental health can adversely affect the physical symptoms and the physical well-being of an individual. That's why during pregnancy, people with depression are more likely to report pain, gastrointestinal symptoms, and dizziness, and often have comorbid anxiety. So anxiety and depression are together usually. They generally have lower attendance at antenatal appointments. So ladies with antenatal depression, because they are depressed, because they are low in mood, because they are sad, they don't feel like going out. They usually have social anxiety. So they do not appear, or they do not turn up at their antenatal appointments. They have poorer nutrition, higher rates of smoking, alcohol, and illicit drug use, and are less likely to take their vitamin and mineral supplements. So again, as you can see, that depression causes a snowball effect. So when you are depressed, you don't want to go out, you don't want to eat usually, or if you eat non-healthy and junk. You go towards the smoking, you go towards alcohol, and you go towards illicit drug use. So it has a snowball effect. Antenatal depression is the most important risk factor for postnatal depression. So, ladies who have antenatal depression most probably will have postnatal depression as well. Antenatal depression is also associated with miscarriage, preterm birth, increased neonatal cortisol concentration at birth, low neonatal birth weight, smaller neonatal head circumference, and poorer neonatal adaptation. These associations make it difficult to determine if obstetric and neonatal complications are attributable to depression during pregnancy or the drugs used to treat it. So as you can see, the depression can push a woman towards smoking, towards alcohol, towards illicit drug use, towards poorer nutrition, towards less taking care of themselves. So all of these can have very adverse physical effects on neonate, which are the woman can miscarry, the woman can have preterm birth, and then when a neonate is born, the birth weight is low, smaller neonatal head circumference, and poorer neonatal adaptation. So usually depression in women can lead to physical symptoms for themselves, like they will have more gastrointestinal symptoms, more pain, dizziness, and then they can all adversely affect the neonate that is born. Treating antenatal depression, the principles of treating major depression during pregnancy are similar to those for the general population. It is especially important to optimize psychosocial support during the perinatal period and adjust treatment accordingly. So then we come on to postnatal depression. Postnatal depression, if we want to prevent postnatal, so what is postnatal depression? Antenatal depression is depression during the 9 months of pregnancy, while postnatal depression is after the childbirth up to 6 months. Maternal postnatal depression is common and is associated with significant harm, including infanticide and suicide, killing the infant and killing yourself. So again, after giving birth, up to 15% of people experience depression. Postnatal depression is typically diagnosed within 6 weeks postpartum. However, the principles apply throughout the year. So usually they say that within 6 weeks it is diagnosed, but postnatal depression is any depression within the very first year after the childbirth. We'll continue talking about this tomorrow.